Good morning and welcome to Radio Friends on Friday, March the 15th. It's a pleasure to have you with us. I want to introduce you to Dr. Erik Grossmann. It's been 10 years since we have sat across and
It's been a long time. It's good to see you again.
Yeah, good to see you too. You were on the old Pepper and Friends show. March is colorectal cancer awareness month, correct?
That is correct.
And that's what you want to talk about. And you're actually with Columbia Surgical Association, an affiliate of MU Health.
Yeah, we're an affiliate of MU Healthcare, and colorectal cancer is the number 2 cause of cancer death in our country. 140,000 people this year will get colon and rectal cancer. The great tragedy is 60% of that could have been prevented by just getting the proper screening, and only about 1 in 3 of our population goes for their screening.
Why do you think that is? It's a stigma that's attached to the screening, isn't it?
Exactly. People have a great fear of the kind of testing you need done. But the important thing to understand is most people with colon cancers have no symptoms. They don't know they have it. Colon cancers are very curable and very preventable, and the tests are not that difficult. Most of us would say a colonoscopy is the best test, but there are some legitimate alternatives, and so it's important to talk to your doctor. If you decide a colonoscopy is not right for you, there are other alternatives, but you need to bring it up, you need to talk to your doctor, and you need to get screened.
Is that where you can do the test at home and then mail it in?
There are tests that can be done at home, and that's why it's important to talk to your doctor. If you're afraid of the colonoscopy or feel it's not right for you, there are alternatives that you can do, but you need to bring it up, you need to talk to your doctor.
Is there an age limit when you say, okay, you've lived this long, maybe it's not necessary to have a colonoscopy?
Yeah, probably the greatest benefit is if you have at least 10 years to live. So if you're relatively healthy and we think you have at least a decade ahead of you, you're still getting benefit from those tests. Now, there are some people who are too old, too frail, too sick to think about those tests, but that would be an individual decision with you and your doctor. So it's just a discussion you need to have. Am I still the kind of person that needs to be screened? Yes or no? And if so, what is the right test for me?
What are some of the things that you can do as far as your diet to help prevent colorectal cancer?
That is a great question. So certainly there are some risk factors you can control. People who have low fiber diets are at risk. People who are overweight are at risk. People who smoke are at risk. Smoking is a risk for colon cancer. A lot of people don't realize that. And a sedentary lifestyle, if you're not active, that is also a risk for colon cancer. But most people that get colon cancer have none of those risk factors. So everybody who is healthy needs to be screened, even if you don't have a risk factor.
Doctor, I thank you so much for coming by today. You had a lot of good information. And the best thing to do is to talk to your doctor about it. But if people want more info online, you can go to MU Healthcare, right? MU Health.
MUHealth.org.
All right. Dr. Erik Grossmann, thank you so much for coming by.
Hey, thank you so much. Great
Pleasure
call.
seeing you once again. And keep in mind the address is muhealth.org for more information. And you find everything you need there.